Hello and welcome. You're watching NDTV 24/7. I'm Rishika Barwa. India is opening up. Our cases and deaths have seen a constant decline in the last few weeks, but there are already alarm bells ringing about the possibility of a third wave coming soon. Crowds are back on the streets and the rapidly transmissible Delta variant is already causing a spike in cases in other parts of the world. To make sense of our fight against the Covid-19 pandemic as it stands today, Dr. Guleria, the head of AIIMS, joins us. Thanks, Dr. Guleria, for being with us. A third wave, according to many experts, is now inevitable. The question, therefore, is not if, but when. When could a third wave hit India? Some say as early as 2 to 4 weeks. How are you looking at this?
So I do agree with you. The third wave is inevitable, and it's basically based on human behavior. Because what is happening is that as we've started unlocking, there is again a lack of COVID-appropriate behavior. We don't seem to have learned from what happened between the first and the second wave. And again, crowds are building up, people are gathering. It will take some time for the virus to again start spreading and for the number of cases to start rising at a national level. But you're right, it could happen within the next, I would say, about 6 to 8 weeks, maybe a little longer. But a lot depends on how we sort of go ahead in terms of COVID-appropriate behavior and preventing crowds.
Right. So you're saying your estimate says 6 to 8 weeks we could see cases rising once again. Are we prepared for an eventuality like that, given the fact that only approximately 5% of our entire population is fully vaccinated with two doses? Is that enough?
So that is the main challenge. Unless we have a large number of people vaccinated, we have to be very aggressive in 2 or 3 things. One is we have to have aggressive COVID-appropriate behavior. This is going to lead to another surge in the number of cases. It may take some time. On an average, waves usually take around 3 months, but it can take lesser time depending on how people behave. On the second thing, of course, is that we have to have a very aggressive surveillance. Last time we saw that a new variant or a new variant which first came from outside and then developed here led to the huge surge. And we know the virus will continue to mutate. So a surveillance which picks up any hotspot and we are able to develop aggressive containment strategy in that hotspot is what is required. And we will have to have aggressive lockdowns in case we see a surge in any part of the country, because unless we have a large number of people vaccinated, we are still vulnerable and we will have future waves in the coming months.
Right. You've already answered part of my next question, which is to do with the large crowds, no social distancing after restrictions have been lifted. My question, therefore, to you was, is another lockdown imminent? Is that the only way that we can actually delay the onset of the third wave?
So you see, the current problem that I see is, from a medical point of view, if you were to ask me, I would say, yes, we should have aggressive lockdowns. But when you look at issues of livelihood, it obviously has a huge effect as far as livelihood is concerned. Therefore, a balance of developing aggressive containment zones, or what we could call as mini lockdown areas, needs to be developed. And that has to be done by aggressive surveillance, looking at your positivity rate. If in an area your positivity rate starts going up and it crosses, let's say, 5% or 10%, and you find that more than 60% of your beds are getting again filled up with COVID positive patients, that area has to have an aggressive lockdown, and testing, tracking, treating, and all the other strategies need to kick in out there.
Right. My question, therefore, is, are we doing that? Is that containment strategy that you're talking about already in place? Because one doesn't want to see cases rise and then, it be a too little, too late scenario.
So I think we need to do that. The issue here is that you see, what happens is when you have a downside as far as the surge is concerned, there is a sort of a issue of getting relaxed and feeling, okay, we've just come out of a big wave, let's now relax and take things easy and start also opening up and doing things that we were not able to do. The only problem is that the virus is just exactly waiting for that to happen, because the virus is still there in our community. We still have a large number of people who are susceptible. And if you combine that too, then this is still a fertile ground for another wave to develop. Therefore, we have to really continue to prevent crowds from developing, do very aggressive surveillance, have an aggressive strategy in place so that we are able to map the whole country and find out areas where cases are increasing and really have a policy of lockdown.
Speaking of lockdowns, do you think that opening up non-essential services, anything that's absolutely not necessary, is therefore a bad idea? Because we're seeing that happen across different states now.
I think we need to do it in a very slow and graded manner and keeping in mind how the cases are behaving in that area. Because, we suddenly open up everything, and what we've noticed between the first and the second wave and now is that actually human behavior is something that is very, very different. No matter what you do, people will start forming crowds. You just had to lift the lockdown, and you had a huge number of people going to hill stations, causing traffic jams and things like that. So we have to factor that in when we start looking at a strategy, because that is not changing.
Right. The onset of a third wave in the UK, Dr. Guleria, it is being linked largely to the Delta variant, which is now contributing to almost 100% rise in cases there. What lessons can India learn, therefore, when you look at the trajectory in the UK?
So I think the first lesson to learn is that we don't need to take this virus casually. We need to understand this virus is changing, and it is changing to survive and infect more and more patients, more and more people. And therefore, we have to be aggressive and try and be ahead of the virus. Every place that you see where people were able to control the number of cases, UK did a very good job by having an aggressive lockdown for many, many months. And again, when they started opening up, the new variant, the Delta variant, again caused a surge in the number of cases. So therefore, what it really means is that we are also in a similar vulnerable situation. And if we are not careful right now, then 3 or 4 months from now, we will again have a similar situation. And that is why, having learned from past experience, we need to be very aggressive. The virus is still mutating, it's changing, and new variants are coming up, which will continue to allow the virus to spread in our population.
Is it worrying that the gap between the first and the second wave, and the gap between the second and the possibility of a third wave is now reducing? The number of months or weeks that we have between the second and third wave is going to be substantially lower as per your own estimate. Does that worry you?
So that worries me, because what we're saying is a change in the behavior of the virus. What we had seen between the first and the second wave was that the first wave we had a viral infection, or the original coronavirus was not that infectious. It was not spreading that rapidly. All that changed with the second wave. The virus mutated and became a highly infectious virus, which was spreading very, very rapidly. Now that virus, which has now become the Delta variant, which is the dominant variant circulating, is very infectious. It's not like what we saw in between the first and the second wave. And that is why one is worried that you may see a much faster spread now with a new variant sort of circulating in our country.
The Maharashtra COVID Task Force has issued a warning. They're saying that, COVID cases could go up to as many as 8 lakh active cases. Is India prepared to deal with this kind of caseload? Is our healthcare infrastructure ready to deal with this kind of caseload?
So what we've learned from the last wave is that we cannot really rely on just not doing anything and hoping that the health infrastructure will manage. Because when you have a surge in number of cases, when there's a huge increase, you will have shortage of beds, including oxygen beds, including ICU beds. And therefore, I think the strategy of working from increasing your hospital beds may not be right. The strategy should be to decrease your number of cases. Or we should have a multi-pronged strategy. We have to work on making sure our cases don't rise. Because if the cases rise and we're not able to control them, any healthcare system globally will actually tend to collapse.
Let's shift our focus to solutions. 2 doses of the vaccine give a better protection against this Delta variant that we're so worried about. Do you think India needs to once again rethink the vaccine gap for Covishield?
So the vaccine gap is something for Covishield which has changed with time, and nothing is actually sort of written in stone. And you remember the initial gap was 4 to 6 weeks, it went up to 8 weeks, then now it's 12 to 16 weeks. So as the virus evolves and as our knowledge about the virus and the efficacy of the vaccine changes, we will have to look at new strategies. And one of the strategies could be again relooking at whether we need to see what should be the dose between the prime and the booster dose as far as Covishield is concerned. But I think we need to have more strong data before that decision is taken.
Do you think, though, that we need to relook at that gap soon, given the fact that, you're saying that the third wave is not very far away?
Yes, I'm sure that the group which is looking at, which is the regulatory group which looks at this, would be looking at all the data, and they would probably take a decision on this.
Right.
I'm quite sure about that, because this is something which should be driven by the science behind it.
All right, so it should be driven by science and not by shortage. My next question to you then is about the strategy. Is it a better strategy to fully vaccinate fewer people, give them a better chance of protection against the Delta variant, or give one dose to a larger number of people? What's the better strategy?
So this is a strategy which UK adopted, and UK adopted this one dose strategy not only for the AstraZeneca vaccine, Covishield, but also for the Pfizer vaccine. Both the vaccines, they gave only one shot and delayed the second shot by 12 weeks when they had a huge surge in the number of cases. So it's a strategy which does tend to work. There were two problems that one was worried about. One was the efficacy of the vaccine with one shot only. There is some data which suggests that vaccine has a reasonably good efficacy if you give one shot, and the partial protection, will it give the virus an opportunity to sort of mutate and develop immune escape in those individuals who are partially vaccinated and get infection with COVID? Will the virus in them have an opportunity to mutate and become decrease the efficacy of the vaccine? I think the data still doesn't support that very much. Therefore, if there is strong evidence, then one could look at this strategy, because we still have honestly a shortage of vaccines, and unless we are able to do that, we will have to look at some strategies which would be unique and would help in preventing or decreasing the number of cases that we will see in subsequent waves.
But Dr. Guleria, as of today, which do you think is the better strategy, given the fact that we need to, already work on contingencies to mitigate the impact of a third wave? Which is the better strategy?
So in my mind, if we are able to find that the one-shot vaccine is able to give you a reasonably good protection, efficacy against the Delta variant, then a one-shot strategy as a temporary solution may not be bad. But like I said, we will have to really look at how things evolve. But this may not be a bad strategy, because you would be able to vaccinate a large number of people and actually give them some degree of protection. You see, what are we wanting from the vaccine? We are wanting the vaccine should actually decrease mortality. You get COVID, you get a mild disease, you don't land up in hospital, you don't die because of COVID. If the vaccine is able to give that protection to a large number of people with one shot, then it's worth giving it as a one-shot vaccine for some time.
So what you're essentially saying, if I understand you correctly, is in that in the short term, we need to at least try and administer one dose to as many people, and perhaps in the long term then, based on vaccine supply, try and give 2 doses as quickly as possible.
Correct.
Right.
Because we will need to give a booster dose at some point in time.
Okay. The Delta Plus variant now in India, this is a further mutation to the already present Delta variant. What more do we know about it, and is it a cause of concern?
So the Delta Plus is a variant which is in the same lineage as Delta variant. So it's in the same if you look at the phylogenetic tree, it's in the same lineage. But with a slight change, there is one more mutation which has been found, which could be a cause of concern, because this mutation, the 417, is something which may change the virus to some extent as far as its infectivity is concerned. This was also found, as far as I remember, in Brazil. So what we need to do is we need to observe. Currently, the WHO has said that this is a variant of interest, but it could become a variant of concern, because currently the number of cases are less. Now, will this variant, this Delta Plus, again become the dominant variant? Will it start causing more cases? That is something we need to observe very closely over the next few weeks. And therefore, it's very important that we continue our aggressive genome sequencing to see now, are we seeing more of the Delta or the Delta Plus, and how is the virus behaving in terms of these two variants in our community.
That was my next question. Are we doing enough to study, therefore, the new mutations, the impact of the new mutations, whether our vaccines will work? There were also questions on whether the monoclonal antibody treatment will work against this variant.
Yes, so these are very important questions. One is whether the monoclonal antibodies, which is now coming into our country, will it work against the new variants, because it has been actually developed against the older variants. Secondly, does the vaccine efficacy come down? And does it come down significantly that we need to really look at a new strategy? And to do all of that, we have to have a very large or a good network of labs which can do genome sequencing, which can tie that data with clinical and epidemiological data so that we know whatever new variant we find, what is its clinical effects, what is its epidemiological effect, and then also tie that up with lab work to see that at a lab level, what is the efficacy of the vaccine. We have to do that, and I think that is where we need to move in the next few weeks, because that is the new frontier that we will have to really develop if we are to sort of succeed in our fight against this virus.
All right, on that note, we're going to slip into a very short break, but Dr. Guleria will continue to be live with us on the other side. We have a lot more questions lined up for him. Stay with us. Welcome back. We're in conversation with Dr. Guleria. Dr. Guleria, there's a very interesting study that's been done in the UK. The study hasn't been peer-reviewed just yet, but it suggests long-term brain damage even in cases of mild COVID, even if you've had mild COVID. What are some of the symptoms that we need to be aware of?
So there is now data emerging that the virus, it's not that just unlike other viral infections, that you get COVID and you're all right. But sometimes you have long-term effects, or what we have been now calling long COVID, and this can have neurological effects. It can affect your brain, it can affect other parts of the body, and sometimes it can persist for a very, very long time. And that the etiology of why this is happening is something which is not very clear. Some theories are there that although the virus is no longer there, the red virus stays in the body for a long time and keeps stimulating your immune system, causing more damage. Or your immune system gets dysregulated because of the viral infection that you've had, and this goes on into a self-destruct mechanism, causing more and more problems. But there is data which suggests that things like memory loss, things like inability to concentrate, and other sequelae can persist even after 12 weeks and can cause a problem. I think we're still learning a lot as far as the long-term effects of the COVID are concerned, because for the previous few months, the focus has been on the acute effects coming out of the acute cases rather than long-term cases.
But how permanent is the damage?
So the data that one has is that it's not very common. The number is, in terms of percentage, is very small. But when you look at it in terms of absolute numbers, it's still something which we need to look at, because if you have a huge number of cases, for example, in Delhi, in India, when you've had a large number of cases, then even 1 to 2% or even becomes significant in terms of absolute numbers.
The other story which has, emerged as a big cause of concern is these 3 kids in Mumbai who had to have their eyes removed because of black fungus. Now, this has a lot of parents worried. How common is black fungus in children? Is this a big cause of concern, really?
So, by and large, it's less common in children because the risk factors that we see for mucormycosis are underlying diabetes. If children are having diabetes and are on insulin, it needs to be very well controlled. The other is we don't see that severe COVID in children, and therefore it's the use of steroids is not that much in them. But one should be very careful about using steroids. But mucor is a fungus which can otherwise happen in all age groups, and it can occasionally happen in children. And if it involves the eye, then it actually does lead to having to have the eye removed. So it's something that we should be very careful about, because the long-term effects of mucor, especially when it involves the sinuses, the eye or the brain, can be really devastating.
Early signs, all doctors say that early detection of mucormycosis is key, especially in children. Are there any early signs that parents need to be careful about?
So if a child is having headache, if there's some degree of blurred vision, if there is a decreased sensation on the face or the nose is getting blocked, and this is happening in children who have had COVID or just come out of COVID.
Right.
And at the same time, there's some secretions coming out of the nose, or there is some blackish discoloration in the throat, you must get a consultation with your doctor, who could take a swab and then see whether there is fungal infection or not.
All right. Dr. Guleria, a lot of people rushing to labs to get antibody tests done after vaccination. Is an antibody test really the best indicator to understand if you've developed immunity against COVID after vaccination?
No, the antibody test is not the best indicator, and not only after vaccination, after getting COVID, there are a lot of people who get every fortnight their antibody test done and sort of plot it and get worried if the titers are coming down or if they've reached a level. I think it's very important to understand that when we get vaccinated, we get two types of immunity. One is what we call the antibodies, which is the B cell immunity, and the other is the cell-mediated immunity, which is the immunity which is long-lasting. And this cell-mediated immunity causes the cells which the immunity which kills the cell which are infected with the virus, but it also has the T memory cells. So over a few months, the antibody titer will come down, but your cell-mediated immunity stays on. And in that cell-mediated immunity, you have some memory cells in the bone marrow which recognize the, let's say, the signature of the virus. And whenever you have a viral infection, these memory cells again quickly start producing the antibodies. So the antibodies don't disappear. The body is ready to develop these antibodies again if it is required. But over a period of time, the titer will naturally come down.
So there's actually no indicator to establish natural immunity or vaccine-induced immunity?
Not at all. And studies which have been done in patients who have recovered from COVID and whose antibody titers have come down using various samples have shown that they still continue to have good amount of immunity, although the antibody titers were low.
Okay. The next million-dollar question, how long will two-dose vaccine immunity last? When will we know if this is going to be an annual vaccine or we're going to need it once in 5 years or 10 years? Are we any closer to those answers?
Not really, but there is a lot of research going on. I personally feel that at least in the beginning, we will need to have a booster dose, maybe sometime next year, as things evolve, because the virus is mutating and we may need to really boost our immunity with a virus which has been tweaked to some extent to cover for the new variants. At the same time, we are developing so many vaccines. We have almost, I would say, 60 vaccine trials going on which are in clinical phase. So I'm sure that over a period of time, we will be able to get better vaccines which have long-lasting immunity and which will cover for newer variants even if they emerge. So I think this year we're going to find a lot of new things happening in vaccine. And by the end of the year or early next year, we may have a newer or second generation vaccines available, which will be better.
All right. Well, thanks so much, Dr. Guleria, for sparing your time and being with us on NDTV. Those are a whole host of very important questions that you've answered. Thank you.
Thank you very much. Thank you.